So acute phase cytokines. These are cytokines released during acute inflammation and that mediate systemic responses. So example of those systemic responses include fever, leukocytosis, and they also stimulate the liver to make acute phase protein. And those acute phase protein, you can also call them acute phase reactants. So let's look at example of these acute phase cytokines. So acute phase cytokine includes interleukin-1. And this interleukin-1 is produced from macrophages, endothelial cells. And this interleukin-1 is responsible for fever, guys. It's going to increase fever. The other one that also increase fever is TNF-alpha. So both interleukin-1, TNF-alpha, both of them could lead to fever. In addition to fever, interleukin-1 also increase adhesion molecules, because those adhesion molecules is going to facilitate the movement of those white blood cells from the vasculature into the tissue, into the site of injury or the site of infection, which is what we call leukocyte extravasation, which we're going to talk about later. Also, they also could increase acute phase protein and a chemokinin production. So the key one for interleukin-1, make sure you remember the fever and an increase in adhesion molecules. Next is TNF-alpha. So TNF-alpha, which is tumor necrotic factor alpha, is produced from the macrophages. And this TNF-alpha could cause fever. It could cause cachexia. Remember, when we say cachexia, means somebody who is losing weight. And that's why in patient who has chronic inflammation, like example like tuberculosis, one of the things that we see in them is what? Fever, right? Night sweat. The third one is what? Weight loss. And why are they losing weight? Because of production of this cytokine, the TNF-alpha. So that's going to cause weight loss because through the process of apoptosis. And if you've not watched the video we did on apoptosis, make sure you watch those videos on apoptosis. Also, they could cause hypotension, septic shock, because they could increase capillary permeability, and that could lead to hypotension. And that's always a high yield, guys. Make sure you remember that TNF-alpha mediates septic shock. It could cause hypotension. It could also increase endothelial adhesion molecules, and it could also increase acute phase protein. So the key one for TNF-alpha, remember the fever, remember the cachexia, and remember the hypotension, the septic shock. Those are the key ones that we need to remember. Next is interleukin-6. Interleukin-6 is produced from the macrophages and T cells. And interleukin-6 is going to stimulate the liver. And then once it stimulates the liver is going to produce acute phase protein or acute phase reactants, which include things like CRP, fibrinogen, serum amyloid A, hepcidin, aptoglobin, right? We're going to see them later in a second. Next is interleukin-8. Interleukin-8 comes from the macrophages and endothelial cells. And this interleukin-8 is a neutrophil chemotaxis. So this is part of the neutrophil chemotaxis. Remember our click and P, right? So C5a, LTB4, right? Interleukin-8, kallikrein, platelet activating factor. So all these are all neutrophil chemotaxis. And you can see one of them is interleukin-8. So remember, interleukin-8 for neutrophil chemotaxis, so it's part of them, and interleukin-6 stimulate the liver to make acute phase protein. And the last one there is interferon gamma. Interferon gamma is produced from the T cells, and it can also be released from natural killer cells. And remember, interferon gamma is what activates macrophages. Remember, we spoke about this when we did granulomatous inflammation, right? Interferon gamma is a key activator of macrophages. Make sure you remember that. And that macrophage could now produce things like TNF-alpha, which can induce granulomatous. Which cytokine is most directly responsible for fever during acute inflammation? What do you guys think? Very good. Interleukin-1. A patient with sepsis develops hypotension, fever, disseminated intravascular coagulation. Which cytokine plays a major role in septic shock? What do you guys think? Very good. TNF-alpha. Remember, we said that TNF-alpha mediates what? Mediates septic shock. Which acute phase protein is responsible for increasing erythrocyte sedimentation rate? What do you guys think? We just talked about it. Fibrinogen. Remember, I said that fibrinogen is what coats the red blood cell, removing their negative charge, and that allows them to be able to work to aggregate together, thereby increasing their density. And when you place them inside the test tube, what happens? They fall faster in the test tube. Next question. A patient with chronic inflammation develops anemia due to iron sequestration. Which cytokine is responsible for this? What do you guys think? Very good. Interleukin-6. Remember, we said that interleukin-6 is going to stimulate the liver to make what? To produce hepcidin, right? And then those hepcidin and also produce what? Ferritin. And then those ferritin is going to help to sequestrate those iron, removing them from circulation and putting them in a storage what? In the storage, thereby preventing the bacteria from using those what? Iron. And that's the pathogenesis of anemia of chronic disease. Which cytokine is a chemotaxis for neutrophil, but not a major acute phase reactant? Remember, we said that our mnemonic for neutrophil chemotaxis is click P, right? So C5a, LTB4, interleukin 8, kallikrein, platelet activating factor, and the best one there will be what? Interleukin 8.